Welcome to Bangkok IVF Center's new flagship clinic located in Lardplao. It is the new forefront of cutting-edge fertility treatment in Southeast Asia. With its 14,000 square feet facility run by a dedicated team of professionals headed by Dr. Vivat Chinhalai. Bangkok IVF Center creates families by leading the field of advanced reproductive technologies, in vitro fertilization, cryopreservation, pre-implantation genetic diagnosis, assisted hatching, and many more. Hi, I'm standing at the entrance of the Bangkok IVF Center, which consists of 4 floors. Once the patient walks in, they're escorted to the reception area. As soon as they enter, they're required a couple of documents. The marriage certificate, passport and ID copy, completion of medical history for both the husband and wife, completion of fertility screening tests. In this clinic, we do not provide single mom or single dad programs, commercial egg donors, gender selection, and surrogate programs. Once the registration is done, the patient is then entered into our system. We then provide a patient profile for every patient. We have 2 parts of it. One is for the husband and one is for the wife. Both the documents have the same information, like the patient profile, the lab IVF, the lab results, ultrasound, patient history, and email, so the doctor can converse back and forth with each patient on a private basis. After the reception, there is the cashier, followed by the interpreters. We have a Chinese interpreter and we have a Japanese interpreter to help us with our overseas patients.
你好，我是中文翻译。はじめまして、日本人コーディネーターのリエです。
As you can see, towards the back is a nursing room to my left and a lab to the right. Welcome to the nursing room. This room has been designed for patients for blood collection, injections, and family education. Once the maternal blood is collected from the nursing room, it is then transferred to the lab. Our lab scientist then takes the maternal blood and puts it in the machine to check the hormone levels, and patients wait about 30 to 40 minutes for blood results. Welcome to the mini bar area, which is located on the ground floor. We have different types of refreshments for you to rest and relax. As you can see, we have the coffee machine, juices, refreshments, or even tea, or even magazines for you to read whilst you wait for your results. This is one of the doctor consultation rooms, one of many that we have in the facility. Patients come here to consult with the doctor face to face. Once that is done, they then move on to the room that is connected next door where the ultrasound and physical examination is done. This is an ultrasound machine which is also connected to the monitor. In this room, patients and the doctor can interact and see exactly and examine what is actually going on. Welcome to the 2nd floor. To my right is a private zone, and to my left is the genetic lab and post-embryo transfer room. Welcome to a private zone, which is located on the 2nd floor. This place has been designed for superstars, VIPs, royal family, and patients who require special assistance from our specialists here. As you can see, to my right is a doctor consultation room. To my left is a nursing facility room. And in the corner here is the ultrasound room. we provide the same facility upstairs and downstairs for all our patients. This is the post-embryo transfer room. Patients are sent here after their embryo transfer procedure to rest and relax for 1 to 2 hours. Welcome to the genetic lab. The details of the lab will be followed after the explanation of the IVF lab on the 3rd floor. Welcome to the 3rd floor of the Bangkok IVF Center. As you can see, this floor is a completely sterilized floor. Once the patient walks in, they change their uniform, as you can see, to a sterilized uniform, a hat, their shoes, and a mask. This floor consists of 4 parts: the IVF lab, the surgical room, the IUI room, and the sperm collection room. I'm just going to take you through to the surgical room now. This area consists of 2 parts. On my left, the egg collection room, and on my right, the embryo transfer room. As you can see behind me, there are 4 beds. These beds are used for pre- and post-egg collection. Pre-post-egg collection, the patient lies down here under the supervision of a certified nurse, where they get enough rest. Once the patient is ready, the nurse escorts the patient to the egg collection room. Once the egg collection has been done, the patient then comes back to rest here. Under the supervision of a certified nurse once again, they're monitored for the vital signs, the conscious level, just to make sure that their condition is stable. Now I will take you to the egg collection room. This room that I'm standing in is the egg collection room. During the egg collection process, there has to be 4 key members present at all times: the doctor, the nurse aide, the scrub nurse, and the anesthetist. As you can see, our room is equipped with the latest technology of ultrasound, oxygen machine, and blood pressure machine. Once the egg has been collected in this container, we then open this window, which is connected to the IVF lab. There will be a scientist on standby who will then collect the container and analyze it. This room that I'm standing in is the embryo transfer room, which is also connected to the IVF lab. Once the embryo has been processed, it's then handed over to the doctor here. The patient can view everything that's going on as the ultrasound machine is connected to the monitor in front of her. As mentioned earlier, in the embryo transfer room, there's a monitor that's connected to the IVF lab, where the patient can view everything that's been going on from A to Z. Now that we're done with the surgical room, I'm going to take you to the sperm collection room. The area that I'm standing in right now is a sperm collection room. For the convenience and the comfort of our patients, we provide them with TV, magazines, wet ones, tissue, and an attached bathroom for the convenience of our patient. This is the sperm collection container. Once the patient is done collecting the sperm, then open this window, place the container in the basket, close the window, lock it, ring the doorbell to notify the scientist. This window is also connected to the andrology center. Once the patient rings the bell, there's a scientist here on standby to pick up the sperm container. It is then placed in the sperm preparation. Once that process is done, it's It's then moved to the CASA microscope. Here, the sperm will be analyzed and screened. Once that has been done, the sperm is either taken to use right away. If not, it's then stored in a sperm tank. Welcome to the embryo lab. As you can see below is an embryo storage tank that we use to store embryo below 195 degrees in liquid nitrogen solution. Once the doctor hands over the egg collection container to the scientist, it is then moved to the oocyte machine where the scientists will analyze and check for the quality of the egg. Once that process is done, then it's moved on to the ICSI and the biopsy machine. After the ICSI or the biopsy, the embryo is then taken to this machine for culture, which could take up to 3 to 5 days. After the culture is done, it's then taken to that machine for further testing. Once the further testing has been done, it is then transferred to the embryo transfer room attached. Welcome to the genetic lab, which is located on the second floor of the building. After receiving the cell biopsy, the scientist uses the stereo microscope for fixing the cell. Then they use a phase contrast microscope to check for the nuclear on the slide. Then the thing is transferred to the thermobite, which is used for the hybridization. Finally, the fluorescent microscope is used to find the result of the embryo, or also known as the genetic screening. This is the IUI room. I'm standing in front of the WGA lab, which will operate shortly. Welcome to the conference room, which is located on the 4th floor of this building. Also the room where you could possibly be viewing this video, where we talk about our facilities and our standard of service that has been introduced to you. We hope that Bangkok IVF Center will always be your first choice for your fertility treatment. Thank you.